Oh, you want it? Oh, you really want it? Okay. Well, I got it for you. That was weird.
You can live pretty well by yourself.
What's good, YouTube? It's your man, the High Value Nurse, checking in once again, back with another video. Now, I've heard you. I've seen your comments. I've got your DMs. You've all have made your voices very, very clear to me. You want a video on how to pass the NCLEX-PN. Now, this video is for nursing students who are getting ready to take the NCLEX-PN. But if you're not a nursing student and you just want to know for future reference, then by all means, welcome to the video. Welcome to the channel, by the way. And before we get into that, I really would love for you guys to subscribe. Hit that subscribe button, hit that notification bell, leave a comment, share with your mama, your daddy, your bald-headed granny, side chick, side dude, everybody, even if they ain't nurses. Just share with them because we just doing fly content over here, you dig? And we about to get it cracking. So you want to know how to pass the NCLEX. You want to know how I passed the NCLEX. Well, ladies and gentlemen, I'm going to keep it very simple. It's not going to be a long, drawn-out video telling you how to pass the NCLEX. No. Straight to the point. Number one, the first thing I did, the first thing you have to be within your studying is be consistent, right? You have to be consistent. You have to really sit down and dedicate yourself to saying, you know what? I really want to pass this joint. This is the key for me to get to some of the finer things in life. Therefore, I need to take the appropriate time and study for this test. It's one of the most important tests you're going to take in your life. You know, so you need to be ready. Dedicate that time, put in the work. That's the first thing you need to know. That's the number one tip that I can give you. Number two, you need to select your materials wisely. Now, what I used four things. First thing I used was Read My Review. Second thing I used was Mark Clinic lectures. Third thing I used was UWorld. Fourth thing I used was the Elsevier question bank. And I dabbled with the book, but I really didn't use the book like that. I more so used Read My Review for content. Now let me break it down exactly how I did it. I took 6 weeks. 6 weeks. Now for some of y'all geniuses out there, it might not have took y'all that long. Oh, and pro tip. When you first decide to go to nursing school, start studying for that exam right away. I wish I would have did that. I wish I would have done that. That way I wouldn't have had to wait so long to take the test. Start studying as soon as you start school. Just even if you dedicating 10 to 20 minutes, 30 minutes every day to answer questions, look at some content, read some content, because the NCLEX, one thing Mark Klimek always said, the NCLEX is like a fantasy world. It's like a perfect world. So learning how to answer those questions from an early stage, I think that can do wonders for you. The only thing it can do is help. So like I said, let me get back to the materials that I use and how I use them. I took 6 weeks, ladies and gentlemen, 6 weeks to study for the NCLEX exam. What I did was each day I would break up each body system into sections along with the medications that went along with each particular body systems or whatever we were studying that day. So if I'm dealing with if I'm dealing with the musculoskeletal system, if I'm dealing with the cardio system, if I'm cardiovascular, if I'm dealing with the respiratory, if I'm dealing with endocrine, I'm breaking each one of those up into a particular section on a particular day, and I'm putting the pharmacology that goes along with it, and I'm studying it. I'm learning the content. I got my content from Read My Review, right? That's from Read My Nurses over there, Miss Regina. She's an NCLEX instructor. She's been in the game for like 10 plus years doing her thing. She knows what she's doing. She's very thorough. I highly recommend you guys take your little change and invest your paper and go over there. And did I spit at the camera again? My fault, y'all. But I recommend y'all take y'all paper, go over there and break some bread with Miss Regina. She gonna get you right. She gonna get you right. And honestly, That's probably all I really needed. But I had a bunch of resources. I have 4. You may not need that many, but this is not how you pass the NCLEX. This is how I passed the NCLEX, because that's what you're here for, right? So I'm telling you how I did it. So I went to Miss Regina. I learned the content. I took 6 weeks, and I think she has a calendar in hers where it's a 6-week calendar, and she broke it down, and I followed that calendar pretty much to a T. So in whatever order the videos went, that's how I studied the systems and the pharmacology. So Monday I got cardio. I'm looking at all the cardio meds. Then I'm answering 100 to 150 questions a day concerning cardio. Tuesday, repeat with a different system. Wednesday, repeat with a different system. Thursday, repeat with a different system. Then on the weekends when I'm off, I would just go answer everything that I learned from that week, right? And I'm just answering all kind of questions that got to do with everything that I learned for that week. So that's what I did. And that's how I got the content. That's how I answered the questions. Now I would do 100 questions from UWorld, 100 questions from Elsevier. You may not even need to do UWorld and Elsevier. I just like to switch them up like that, because what I found out is that if you answer different questions from different test banks, number one, it's only so many ways they can ask you a question. Right? It's only so many ways, because there's only so many ways they can say, well, if a patient is suffering from Cushing's disease, then what is the proper way to handle that situation? It's only so many ways they can put that. You know the content. Once you figure out the content, you know in which way that you need to answer the question, right? So once you get that in your head, it won't be that difficult to answer NCLEX questions to that degree. Also, another thing too, you got to remember this. She has something called Quick Facts. Get that book. It is a list of really quick facts that you need to know for the NCLEX. And I saw questions directly related to that book in on the NCLEX. And I looked at that and I studied it for 6 weeks. Now, Mark Clemick, right? I was an Amazon truck driver. I was driving for Amazon for a few months. While I was out there delivering packages, I had the Mark Clemick lectures in my ears playing 24/7, 365. Well, not 365, but you get what I'm trying to say. It was playing all throughout my work schedule. When I'm cleaning, I'm putting it on the speakers. I could pretty much teach those lectures from beginning to end. He has 12 of them from the ones that I use, and they probably here on YouTube somewhere, you know what I'm saying? But I know he does in-person NCLEX training as well. I think he's out of Ohio, and he has like his blue book and his yellow book system. I followed that, and it was good. I learned a lot from Mark Clemick too. I could pretty much recite those lectures back and forth. That's how obsessed with the game I became. You have to become obsessed with this test. If you are somebody, if you ain't a genius or something like that, you got to become obsessed with it. This has to temporarily become your life. Every moment you waking up thinking about this test, passing this test, because you know that this is the key to getting to the paper. Don't let them tell you LPNs ain't making no paper. I'm here to tell you that's cap. LPNs are making paper. I'm living proof. So don't let them try to stop you with that. They definitely getting that guap, if you feel what I'm saying. So do that, and I'm pretty sure you won't fail. I'm pretty sure you will not fail, because let me tell you something. The day that I took the NCLEX, I passed in 108 questions. Or was it 100? I think it was 108. I passed in 108 questions. I don't remember how long it was, but I wasn't even nervous. I tried to make myself nervous, bruh. I tried to make myself nervous. I couldn't do it because I was that ready. And I was ready to knock it out and get it over with. But when I tell you, I'm going to tell y'all what to expect. Because if it's something that you really want, and when you figure it out, that you pass that test, let me tell you something, bro. That is a feeling that you will never, it's like being high on coke. Now, I've never done coke before, but I would imagine that's what doing coke will feel like for the first time. I was literally on a high for 3 days. I kid you not. 3 days straight, I was on a high. I had booked a trip to go to Miami, or was it Orlando? I think it was Orlando for my girl's birthday, and I had just happened to pass the day before we left. Oh my God. You talking about somebody who would, only thing that could have got me down if you would have told me somebody in my family had passed away. That's literally the only thing that could have got me down. I was on a high. Like, I was literally on a high for like 3 days. 3 days, I kid you not. It was just unexplainable. And I understand why people become addicted to certain things, because now you're trying to chase that high. You're trying to chase that high. You're trying to complete goals and everything like that. And you want to feel that high again. I think that's why I'm going for my NCLEX. I think that's why I'm going for my RN, so I can get that high. It's that feeling of putting in the work, right? Once you put in the work, you set out a goal and you accomplish it and you attain it and you reap the benefits. That's a feeling like no other. That's a feeling like no other. So I promise you, after you put in that work, after you put in that time to study, it's going to be well worth it. It's going to be well worth it. Buckle down. Get all the distractions out of your way. Tell your mama to watch the kids for a week. If that's what you got to do, ask her, mama, watch the kids for a week. I'm going to get you a Birkin when I pass this test. You dig? Or something. Take her somewhere nice for watching the kids. I don't know. Do whatever you got to do to pass this test, because once you pass this test, I'm telling you, it's only up from there. If you navigate right, you put God first, you're going to be all right. If you like these videos and you want me to keep making this type of content, let me know. Put it in the comments. What do you want me to talk about next? I got a whole list full of things that I want to talk about, doing it in this style of video. So let me know. And until next time, boys and girls, I bid you adieu. Peace. Don't forget to like my video and subscribe to my content. We almost at 1,000 followers. Let's run it up. Let's do it again. Did y'all like this? Short, sweet, straight to the point. I ain't like them other YouTubers out there that want to string you along for 40 minutes before they give you the game. I give you the straight game to your face as soon as you turn on the joint. So I'll holla at y'all in a minute. Deuces. You never was the plan, but I fell slowly. How I'm supposed to walk away when you the one that knows me? Always gotta be a secret, girl, that's what you told me. You quick to say what your man don't know. So how you jealous when I talk to